Okay, Mike, both of the social streams are going.
All right,
so
I'm going to let all the reporters in. Kelly, I have a thunderstorm here, so if I lose power, you're up.
Okay.
Okay, very good. Good afternoon, and thank you again for joining the briefing on the City of Philadelphia's response to COVID-19. Today, our speakers are joining the briefing virtually to adhere to social distancing guidelines. And we will begin our briefing today with opening remarks from Managing Director Brian Abernathy. Brian, you have the floor.
Thanks, Mike. Today, I'm happy to bring some good news for Philadelphia businesses that have been impacted by successive crises, both the COVID-19 pandemic and the recent civil unrest. This morning, we announced additional supports for Philadelphia's small neighborhood businesses to help them restart and reopen. These new efforts include $1.4 million in initial funding for the Restore and Reopen program. This funding is dedicated to helping businesses in historically disadvantaged communities that experience damage or inventory loss from the recent civil unrest to cover expenses, to recover, and to reopen. The Commerce Department is partnering with the Merchants Fund to launch the grant program and is actively seeking to raise additional funds in order to reach more impacted businesses. We also announced a $3 million Restart PHL Loan Fund. Created by PIDC, this loan program provides flexible, low-cost capital to small businesses with less than $5 million in revenue for costs associated with improved business resilience or growth. The fund is targeted to historically disadvantaged communities with a specific focus on Black and Brown-owned businesses located on commercial corridors in low-income areas. Applications for both of these programs are expected to be live later this month. We hope they can provide a bit of a lifeline for businesses that continue to struggle. Now, regarding our move to the yellow phase, today we did release guidelines for outdoor dining, which we hope will provide businesses throughout Philadelphia the opportunity to reopen with safe options. Restaurants that have patio areas on their properties or already have sidewalk cafe licenses are authorized to offer outdoor seating beginning tomorrow, Friday, June 12th. Outdoor dining will be expanded to give restaurants 4 potential options based on their location. A sidewalk cafe allows for daily use of sidewalk area in front of the businesses for restaurant seating. Streetery allows for curbside parking at street level or platform built on the street to be converted into outdoor dining or takeaway area for food and beverages. Temporary use of private lots for dining allows restaurants to convert spaces in their parking lots into restaurant seating and to place seating into vacant lots in most commercial and mixed-use zoning districts. Temporary street closure. It's a pilot program beginning this summer that allows for temporary closure of certain streets for shared restaurant seating. All applications for new or expanded outdoor dining will be available online late Friday, June 12th, with review beginning on Monday, June 15th. Joining us today are Acting Commerce Director Sylvie Gallier-Howard and Deputy Managing Director Mike Carroll, who oversees the Streets Department, to answer questions about outdoor dining, and Sylvie will certainly answer questions about our grant programs as well. Finally, an update on construction restrictions. You may recall that construction activity in Philadelphia restarted on a limited basis back on May 3rd. Most construction work was reauthorized in the following weeks. Today, the city is lifting the remaining limitations on where, when, and what types of work are allowed. Most significantly, weekend residential construction, demolition of attached properties, and non-emergency work inside occupied dwelling units are no longer prohibited. Like all businesses, construction job sites must, of course, comply with COVID-19 safety requirements, but they are allowed to restart. A list of FAQs on this topic is available on LNI's website, phila.gov/li. Moving forward, these briefings will be more focused on health department updates, but the mayor or I will join when we have other substantive announcements like what I just shared. And now I'm happy to turn it over to Dr. Farley for the health update.
Thanks very much. The positive changes you just heard really reflect the fact that we are making continued progress against the coronavirus epidemic here in Philadelphia. So here's some of the numbers and facts behind that progress. Since this time yesterday, we've confirmed 156 new cases of the coronavirus infection in Philadelphia residents, bringing us to a total of 24,107 since the beginning of the epidemic. Now, that 156 number is a little higher than we've seen in the past few days, but we did get many test results in today, more than 2,100. And the percent of tests that were positive is about 7%. That's a very low number. We peaked at the peak of the epidemic at about 40%. So that low percent positives is a really reflection of that the epidemic is very much on the wane. We are also seeing very low numbers of people coming into hospital emergency departments with symptoms consistent with the coronavirus infection. That's one of our early warning signs we're watching closely, and it's good that that number is still down. Now, many people have asked about whether we would expect to see more spread of the coronavirus infection because of people being involved in protests, because there were definitely crowds on the street in Philadelphia last week. We are concerned about that. However, we did know that many of the protesters were wearing masks. In many cases, they were keeping a distance from other people. And all of our numbers we're looking at so far are saying that there's no evidence of transmission yet. Now, it's still early. We're going to have to watch this for at least another week. But so far, so good. And we hope that the steps that they took did prevent the spread of the virus. And maybe that's a model for how we deal with outdoor gatherings in the future. For hospitalized patients, we're now at 322 with the coronavirus infection in Philadelphia hospitals and 598 in the region as a whole. Those numbers are decreasing. We're now down about 70% from where we were at the peak. Our outbreaks in nursing homes are also very much receding or even ending. The majority of nursing homes in the city now have been more than 2 weeks since they've seen the case. And overall, across all the nursing homes in the city, we've only had about 10 cases in the past 2 weeks. As far as deaths, we have only one death to report today of the coronavirus infection, bringing us to a total of 1,434 since the beginning of the epidemic, of which 748 or 52% were nursing home residents. Now, we do about once a week do a match of our reportable disease database with death certificate database. And when we do that, we tend to uncover previous deaths. We'll be doing that tomorrow and the next day. So we would expect to see an increase in the number of deaths in the next couple of days. But so far, the fact that we have only one report today is very much a sign of progress. Our testing sites across the city are widely available. Now, a number of those testing sites did close last week with the unrest, but almost all of those have reopened. And I would say testing has never been more available than it is right now in Philadelphia. If you want to be tested, go to www.phila.gov/testing, and you can find all the sites that are available in your neighborhood across the city and information about them. We're recommending testing for anybody who has a new onset of respiratory symptoms or anybody who thinks that they may have been exposed to this infection. And that includes people who participated in the protests. Now, as you heard from the managing director last Friday, Philadelphia moved into the yellow phase. That means that a number of activities are allowed to restart, including stores, non-food stores, that is, offices, and daycare centers. And as you heard, outdoor dining is going to start tomorrow. One thing that may have been lost in all that happened in the past week or so is that we have very clear standards for how we operate all those activities safely, which we are calling safe mode. And for each activity, there's a checklist of items that people need to do in order to make sure that we are reducing and minimizing the risk of the spread of the virus in that setting. There's 8 items on that safety checklist that includes masks, barriers between people, keeping a distance between people, reducing crowds, isolating people, and identifying employees or other folks that may have symptoms and making sure that they stay away from others, hand washing, cleaning procedures, and communicating the rules to everybody. Those 8-item checklists are something that we're very serious about and we're going to be very much promoting. What does this mean for individual Philadelphia residents? Remember 3 things at all times: masks, distance from other people, and hand washing. In particular, around masks, you are going to be expected when you go into a store or an office or a place where there's other people to be wearing a mask. We need to establish that as kind of the norm, something that just everybody does. We are still differing a little bit from the state in that we're not recommending any social or religious gatherings. They're permitted under the state's guidelines for up to 25 people, but we're not recommending them at all right now because we still have, although we've had a lot of progress, there's still many cases of the virus in Philadelphia today. Overall, we're very pleased with the progress. We're looking forward to more progress in the weeks to come. If you want more information about anything that I've just discussed, go to our website, www.phila.gov/COVID. Thanks, and I'll turn it over now to Armando.
Armando will now provide the Spanish language translation of both Dr. Farley's and Brian Abernathy's comments.
Mensaje del director general Brian Abernathy para el jueves 11 de junio del 2020. Buenas tardes. Hoy me complace compartir buenas noticias para los negocios de Filadelfia que se han visto afectados por dos crisis sucesivas, la pandemia del COVID-19 y los recientes disturbios. Esta mañana anunciamos medidas de apoyo adicional para ayudar a las pequeñas empresas de Filadelfia como el proceso de reapertura. Estas iniciativas incluyen $1.400.000 en fondos iniciales para el programa de restauración y reapertura. Ese financiamiento está dedicado a ayudar a las empresas en comunidades históricamente desfavorecidas que sufrieron daños o pérdidas de inventario debido a los recientes disturbios para cubrir los gastos de recuperación y reapertura. El Departamento de Comercio ha establecido alianzas estratégicas con Merchants Fund para lanzar el programa de subvenciones y está buscando activamente recaudar fondos adicionales para ayudar a las empresas más afectadas. También anunciamos el Restart PHL Loan Fund de $3 millones. Creado por el PIDC, este programa de préstamos proporciona capital flexible a pequeñas empresas con ingresos menores a los $5 millones para cubrir gastos asociados con la mejora de su capacidad y el crecimiento empresarial. Este fondo está dirigido a comunidades históricamente desfavorecidas con un enfoque específico en negocios propiedad de comunidades de color ubicados en corredores comerciales en áreas de bajos ingresos. Esperamos que las solicitudes para ambos programas estén disponibles a fines de este mes. Y ahora quisiera hablarles sobre el paso a la fase amarilla. Hoy publicamos las directrices para el servicio de comidas al aire libre que esperamos les brinde a los restaurantes de Filadelfia la oportunidad de volver a abrir con opciones más seguras. Los restaurantes que tienen áreas de patio en sus propiedades o que ya tienen licencias de café en la acera están autorizados a ofrecer mesas al aire libre a partir de mañana, viernes 12 de junio. El servicio de comidas al aire libre se ha ampliado para ofrecer a los restaurantes 4 opciones potenciales para implementarlo según su ubicación. 1. Café en la acera. Permite el uso diario del área de la acera o vereda enfrente del negocio para ubicar los asientos del restaurante. 2. Streetery. Permite que el estacionamiento ubicado a nivel de la acera se convierta en un comedor al aire libre o un lugar para llevar o recoger comidas y bebidas. 3. El uso temporal de estacionamientos privados para servicios al aire en sus estacionamientos y colocar asientos en lotes disponibles en la mayoría de los distritos de zonificación de uso comercial y mixto. Y 4, el cierre temporal de las calles. Este es un programa piloto que comienza este verano que permite el cierre temporal de ciertas calles para la ubicación de mesas de los restaurantes. Todas las solicitudes para ofrecer el servicio de comidas al aire libre, ya sean nuevas o ampliadas, estarán disponibles al final de la tarde del día viernes 12 de junio y la revisión comenzará este lunes 15 de junio. Hoy nos acompaña Sylvie Galliard-Howard, la directora interina de Comercio, y Matt Carroll, el director general adjunto que supervisa el Departamento de Calles, para responder a sus preguntas sobre el servicio de comidas al aire libre. Para cerrar el día de hoy, también ofreceremos una actualización sobre las restricciones a las actividades de construcción. Pueden recordar que la construcción en Filadelfia se reinició en forma limitada el día 3 de mayo. Hoy, la ciudad está levantando las limitaciones restantes sobre dónde, cuándo y qué tipos de trabajo están permitidos. Los cambios más significativos son los siguientes. No se prohíbe la construcción residencial durante los fines de semana, la demolición de propiedades adjuntas y los trabajos que no sean de emergencia dentro de viviendas que están siendo ocupadas. Al igual que todas las empresas, el sector de la construcción deberá cumplir con los requisitos de seguridad contra el COVID-19. Hay una lista de preguntas frecuentes sobre este tema disponible en el sitio web de licencias e inspecciones, fila.gov/LI. Asimismo, informamos que en el futuro estas sesiones informativas se centrarán más en las actualizaciones del Departamento de Salud, pero el alcalde, Brian Abernathy, también participarán cuando hay anuncios importantes. Y esta es la actualización en materia de salud para el día jueves 11 de junio. Buenas tardes. En general, hoy les traigo buenas noticias. Vemos un retroceso en la epidemia y un progreso sostenido. Desde ayer se han confirmado 156 casos de coronavirus en Filadelfia. Actualmente tenemos un total de 24.107 casos en toda la ciudad. Estos son los resultados de 2.100 pruebas que recibimos el día de hoy. Los resultados positivos han disminuido de los 500 a 600 reportes diarios que estábamos comunicando a mediados de abril. Pasamos de reportar un 40% del total de casos positivos a un 7% al día de hoy. Esto es un gran avance. Las visitas a urgencias de personas con síntomas del COVID-19 han permanecido también muy bajas. Estamos preocupados por un posible brote a raíz de las protestas recientes. Muchas personas usaron máscaras y mantuvieron la distancia social, pero aún así estaremos monitoreando todos estos escenarios. Hay 322 personas que están hospitalizadas por la COVID-19 en Filadelfia y 598 en la región sureste de Pensilvania, incluyendo el condado de Filadelfia. Los casos en los hogares de ancianos también han disminuido. Se han reportado 10 casos la semana pasada. Lamentablemente reportamos un fallecimiento por la COVID-19 en la ciudad. Hay un total de 1.434 personas que han muerto por la COVID-19. 748 o el 52% de estas muertes han sido en hogares de ancianos. Respecto a los centros de pruebas, casi todos han abierto después de las protestas. Las pruebas están disponibles para todos aquellos que presenten síntomas o hayan estado expuestos al virus. El viernes 5 de junio pasamos a la fase amarilla. Las oficinas, tiendas y guarderías han abierto con ciertas limitaciones. El gobierno estatal añadió también las actividades deportivas. Nosotros estamos en el proceso de desarrollar pautas para ello y las anunciaremos próximamente. Para los comercios que están abriendo gradualmente, les rogamos implementar las mejores prácticas del plan Estás más seguro en casa. Vamos a promover y exigir el uso de una lista de verificación de seguridad para los comercios que incluye el uso de máscaras o cobertores faciales en los establecimientos comerciales, la instalación de barreras de plexiglas, el mantener la distancia social en todo momento, el aislamiento cuando sea necesario, el lavado de manos frecuente y la limpieza total de las superficies y los locales comerciales en general, además de una comunicación clara y eficaz con el público. ¿Qué es lo que recomendamos? El uso de las máscaras, el mantener siempre la distancia social, el lavarse las manos frecuentemente y seguimos sin recomendar reuniones presenciales aunque estén permitidas para grupos de hasta 25 personas por medida de seguridad. Hay que recordar que con su ayuda podemos superar este gran reto. Muchas gracias.
Okay, thank you, Armando. And we are now going to move to the Q&A portion for members of the media. As Brian Abernathy noted earlier, we are joined today by Sylvie Gaillard-Howard, who is the city's Commerce Director, and Deputy Managing Director Mike Carroll. He's Deputy Managing Director for Transportation, Infrastructure, and Sustainability. Mike, I hope I got that right. They are here to answer your questions related to the outdoor dining restrictions that we just announced. And please note, limit your questions to topics related to the COVID-19 pandemic. If time permits, we will open the floor later to other topics. And if your hand is currently raised and you're planning to ask on another topic now, please lower it and we will try to get to you later. And of course, remember, because of limited time, only one representative from each media outlet for the first round. And please limit your questions to 3 or fewer. We will do a second or even a third round if time permits. For now, let us go to Jeff Cole of Fox 29.
Yeah, first for Dr. Farley, a few questions for Dr. Farley. Dr. Farley, the way you're tracking numbers now and what you're seeing of positive signs, are we on track for green next week?
Well, we wouldn't be able to go to green next week. You know, the way that the governor has said it is that the earliest counties could consider going to green would be 2 weeks after they go to yellow, and then it would be take place a week after that. So it would be a minimum of 3 weeks from us going to yellow, which is last Friday. I think It's unlikely, I would say, that we would be ready 3 weeks from last Friday, but I am pleased with the progress we're making, and we hope to be giving people guidance perhaps next week, give a sense of what green would look like in Philadelphia.
Yeah, with the positive news that you've laid out again in terms of the numbers and the one death, and considering the economic loss, you've said, I'm not an economist, I can't sort of speak to these issues, but again, another 1.5 million people have applied for unemployment. Do you see any way, as the numbers improve, to try to quicken the pace to help folks to reopen and get back to work?
Well, I think the steps we're talking about today, allowing outdoor dining and allowing activities we put is a step forward, because we still are seeing a fair number of cases. And I think that we will advance the green as soon as we feel that there's a safety level that makes us comfortable doing that. Every step along the way, we are balancing out the risk of the virus with the very real problems associated with the shutdown. And we think that that mix does permit us to go to green in the not too distant future, but not quite yet.
Okay, and I had one question for Brian real quickly. Brian, COVID-19 claimed the pools in the city, and you had said that it was just too many folks to hire in a short period of time. But there's been a loss of life now with some kids, unfortunately, getting into the water and trying to cool off on a hot day yesterday. Can you reconsider closing of the pools? Are you concerned the inevitable sort of outgrowth of that is that kids are going to find other ways to stay cool, and that could be dangerous?
What happened yesterday was a tragedy, and things like that unfortunately happen almost every summer, where folks get into one of the rivers or into one of the creeks, and it's horrible. And we are going to continue to try and monitor that and make sure it doesn't happen, and educate folks about the danger of getting into those waterways. The pools, and again, Jeff, I think we were pretty clear. The pools didn't open for three reasons, right? One was just logistics, the ability to hire people and the amount of time we had as it related to the pandemic. Two, safety. We're still not recommending that pools or private swim clubs open. And three, there are certainly some budget considerations. We are looking at other ways to cool folks off. And so we do hope to have a number of spray grounds and other facilities open to allow kids to cool off and to play in their communities. We certainly recognize the issues, but at this point, we're not in a position to be able to reopen pools.
Thank you.
All right. Thank you, Jeff. Now we'll go to Laura McChrystal of the Inquirer.
Hi. I'm wondering, first of all, Dr. Farley, you mentioned that maybe some of the guidelines for places that, businesses and daycares that were able to reopen so far, that might have gotten a little lost in everything last week. So have you noticed, based on that, are people following those guidelines? Do you have some concerns? Is there any enforcement or reminding going on?
I don't have any data on that. It's too early. We haven't really gotten any information back from individual places. I can tell you that we are working with ways to come up with ways to communicate those guidelines to all the stores in the city in multiple channels, just to continue to reinforce them. As I said when we announced them, we will enforce them with inspectors when we can, but there's no way we're going to be able to get to all the different stores in the city. And so we're going to have to rely on people who manage those stores to take them very seriously, and rely on the public as well to remind people what the guidelines are. So every opportunity I can, I'm going to really talk about the safety guidelines so that people do follow them.
Okay. And I have a question on restaurant outdoor dining. Brian, you said that the applications would be reviewed beginning on Monday. How soon will those start to get approved for restaurants so they can open?
Mike, you wanna, or Sylvie, do you want to tackle those?
Yeah, we've committed to a 3-day turnaround for sidewalk cafes and for what we're calling streeteries along the curb lane in parking spaces. If folks are looking to do a street closure, that's going to be an application requires that some organization or group of establishments sponsor that. That will take more time, but I'm hopeful that we can turn those types of applications around in about 5 to 10 business days, no more than that, certainly. I won't speak in detail on what's involved in getting a private lot closure, but I do understand that LNI is trying to make that an expedited process as well. And folks have questions, they can go on the phil.gov/safer-at-home webpage. There's a blog post that explains a lot more, and the guidance is up there, and they can get the detail they need there as well.
Okay, and my last question would be for the street closures for restaurants. If a group of restaurants or an organization applies, what kind of time frame might that be? Would it be like the street can close for the whole summer, just a weekend? What would that entail?
It wouldn't be for the whole summer. It would be an event type closure, and it might extend as long as I'll call it 60 hours. So it could be a Friday night, Saturday night, Sunday night type closure, and the setup time required to make that happen.
Thank you.
All right, thank you, Laura. Now we'll go to Lauren Make of NBC 10.
Hi, guys. Thanks so much. To continue on the outdoor dining, my first question is about that. You mentioned different types of permits and that you're going to try to do a quick turnaround. Do all of those options require permits, or could some restaurants just go ahead and start offering it if they have the space? Will they always have to go through a permitting process?
So restaurants that have existing cafe licenses do not need a permit. They just need to make sure that all their licenses are up to date. Folks that have an outdoor patio space and have existing licenses and permits for that can go ahead and operate on that basis as well. Actually, what we need for folks to do is to register if they do not have an outdoor sidewalk space currently, by the fact that they're in an area of the city which had not previously allowed for that. So we need for those folks to register for that. And then we need a permit, and it's going to be a pilot program that establishes a permit for street closures. And also there's going to need to be a zoning permit for folks who are using a parking lot or an adjacent lot for outdoor dining.
Also on the outdoor dining issue, are there any street closures that you're already considering at this point in any parts of the city?
We've had communication from a number of bids, and what I'll expect is for them to update themselves by looking at the guidance and to provide us with an application.
Okay. Can you say where those are?
Yeah, those again are on the phil.gov/
What locations?
I'm sorry?
I meant what locations, what streets?
Most of the bids have collectively asked for consideration. None of the bids have identified explicit streets, not that I'm aware of, but they have geographies. And so we're thinking it's probably the commercial corridors that sort of form the spine of those streets that we need to evaluate. But we haven't seen their proposal yet, and that's important. I also want to make clear to everyone that a lot of these locations people think about happen to be state routes as well. So we will coordinate with PennDOT for permission to do that. And the city will be a partner, and we'll make sure we're involved in that coordination as much as possible.
Okay, and my last thing is regarding the need for social distancing as we move into the summertime. This is probably for Dr. Farley. Given the need for continued social distancing, what's the plan for cooling centers in the city? Will they open? And if not, do you have any other plans to be able to keep people cool, especially seniors, but really anyone?
We're looking at that right now. We are worried about, the heat and having people get out of heat. We're also concerned, though, the very people who are at risk for heat-related illness, being grouped together in a facility is not necessarily very safe for them. And so we'll get more information out later on that.
So no decision has been made about whether cooling centers will open?
I'll have to get back to you on that.
Okay. Thank you.
All right, thank you, Lauren. Now we'll go to Layla Jones of Billy Penn.
Hello, I have a question for Dr. Farley. Dr. Farley, looking at the data for the negative cases on the website, it seems like the total number of daily tests has dropped pretty significantly in the last week. Is that true? Is that accurate?
There was a decrease because a number of the testing sites shut down with the unrest. We were up at about 1,800 to 1,900 tests per day, and they dropped down to about 1,500 tests per day. But it does look like they're bouncing back now.
Okay, and so are you concerned at all about that drop, or since it's coming back, you think it'll level out?
I'm not too concerned about it. That was a relatively small percentage drop, and 1,500 tests a day is still enough for us to keep a pretty good eye on what's happening to the epidemic.
Okay, thank you.
Taylor, are you good?
Yes.
Very good. So we will go to Pat Loeb of PIW. Hold on one second, Pat.
Okay.
There, go ahead. You're up.
Thanks. Dr. Farley, have you started contract tracing yet, or are the numbers still too high? And you probably would have
we are doing, I would say, piloting contact tracing. We're doing a relatively small number of cases per day to really work out our processes while we're hiring staff and putting in place the software for us to do it full bore.
Any significant data gathered from that yet?
Not much. It's really, we're learning more about the process.
All right, Pat, go ahead.
Thank you. Just that's it.
Pat, did your dog have any further questions, or is he good? Let's go now to our Hennies Figueroa, of Univision. You're up. Hold on one second. Trying to unmute you there. Our Hennies, try unmuting yourself if you could. I'm not able to.
Okay, do you hear me?
There, go ahead. You're up.
Nice, thank you so much. I will need to ask in Spanish. Armando is there?
Yes, he is.
Hello? Okay.
Yes. Armando?
Gracias.
I believe
Okay.
he's there. I'm not seeing him.
Okay, I will try to ask in English, okay? For Dr. Farley. Just I would like to know, understanding that we are in yellow phase and we're going to pass to the green phase, what message can he send to barbers and beauty salons because they are waiting to reopen the business and they don't know nothing about if the authorities in Philadelphia are working on?
So barbershops and beauty salons, or those personal care businesses, are not allowed to be operating in the yellow phase. They will be allowed to operate in the green phase. I can't tell you when we're going to go to the green phase. I can say, though, that we're making progress towards that. And I'm hopeful we'll be doing it in the coming weeks. The minimum amount of time we would need to get to the green phase would be 3 weeks after we went to yellow. I doubt that we're going to be there that soon, but hopefully not too far after that.
¿Quieres la respuesta en español, Argenis? Mi mensaje para los barberos y el personal de los salones de belleza y del cuidado personal es que aún no estamos en la fase verde, solamente estamos en la fase amarilla y no sabemos exactamente cuánto se va a poder avanzar para llegar ahí. En las próximas semanas vamos a pasar a la fase verde y va a tomar esto al menos unas 3 semanas después de ingresar en la fase amarilla.
Perfecto, gracias Armando, eso es todo.
¿Cómo no? Thank you.
Argenis, did you have anything further?
¿Tiene alguna otra pregunta, Argenis?
No, solo esa. Muchísimas gracias. Thank you.
That was it. Thank you very much.
Very good. Thank you. And next we go to Laura Smythe of the Philadelphia Business Journal.
Hi, thank you. My question just has to do with the outdoor dining. With the 4 options that are allowed, can restaurants apply for more than one to mix and match, or are they restricted to applying to just one option?
No, there's no restriction on applying for more than one, but in the guidance there are some, constraints that they need to understand with respect to expanding in front of neighboring properties and so forth. There is, however, for any given establishment currently, a number of seats/tables that they have as their approved occupancy, and so this should not be seen as an opportunity to expand occupancy beyond what's already approved. That won't be permitted.
Sure. Thank you.
Laura, are you all set?
Yeah, all set.
And I saw Dr. Farley put his camera on. Did you want to add something to that, Doctor?
No.
Oh, okay, very good. I don't see any further questions. Are there any further questions on COVID-related topics or any questions on other topics? If so, please raise your hand, and there are a couple. So let's go to Cheryl Spreitzer of 6ABC.
Hold on. I think I'm there? Okay.
Good.
Brian, I was hoping to get the mayor, but I'm hoping maybe you can answer this question. We are analyzing data from the FBI in regards to youth loitering arrests. And between 2016 and 2018, the data shows that more than 15,000 youths in Philadelphia were arrested for loitering. That number is 10 times more than the next city, which is Nashville, Tennessee. Can you explain why there's such a large discrepancy of arrests between our city, the next city, and why that number is so high?
No, we're going to need to look at the data in more detail, have a conversation with Commissioner Outlaw, and see if we can't get a better answer for you. But I can't answer that question today.
Okay, thank you.
Yep.
Cheryl, did you have anything else?
No, that was it. Thanks.
Okay, if you want to forward that question to our inbox, press@phila.gov, we can try to get back to you.
I will. Great. Thank you.
Okay, let's go now to Natasha Brown of CBS 3.
Hi, this question is for Brian. A couple questions, actually. First, just in terms of looting, we're hearing that there may have been some more widespread looting in center city businesses overnight at some point. Are you aware of those reports, or have there been any arrests, or do you know anything about that?
I don't have that data. I did talk to the commissioner this morning, and I did not get that report. So we'll certainly circle back and get back to you.
Okay, and one other thing, a petition apparently is being circulated to change the name here in Philadelphia of Taney Street that runs from North Philly to South Philly due to it being named after a former Supreme Court justice who delivered the majority opinion declaring that slaves are not U.S. citizens. And we've seen lots of monuments come down in the wake of unrest and racial divide. Are you aware of that petition here in Philly, first of all, and does the city have any plans on considering a request to change it?
So I'm not sure. So I'm not aware of that petition specifically, but I am aware of a number of individuals who are interested in looking at not just Taney Street, but a number of streets in Philadelphia and whom they're named for. And certainly, I think this is a very healthy dialogue and conversation to confront our racist past. And so welcome the conversation and look forward to that dialogue ongoing.
Okay. Thank you very much. That's all I have. Thank you.
All right, thank you, Natasha. And seeing no further questions, that concludes our briefing. We are currently on a Tuesday and Thursday schedule for these briefings. So the next one obviously would be next Tuesday, pending other developments. And we will continue to issue press releases Monday through Friday on COVID-19. Thanks.